The surgical count process is the counting of all items used in the surgical room to ensure they have all been removed from the patient unless intentionally being left in them. A large number of patients and emergency cases cause a dense amount of work onto the nurses, in which more error occurs. The surgical count is used to help the nurses reduce the risk of leaving a surgical item in the patient's wound, body, or cavity. The count is a structured procedure performed by two nurses, the circulating nurse and the instrument nurse, in which one must be a registered nurse, where one counts while the other documents items onto the count form. The nurses perform the count a few times throughout the procedure. Firstly is the baseline/first count. This is performed while setting up the instrument table. Secondly is the first closing count, which is performed when the surgeon has completed a majority of the surgery and is beginning to close the patient. This is performed twice if the patient has more than one cavity opened. Lastly is the final count that occurs at the closure of the skin. If a changeover in staff occurs or an item is added to the sterile field, a further count must also be completed. Stated by Elizabeth Edel in the AORN journal, counting is a high-risk, high-frequency activity. Being thorough with these counts decreases items being left in the patient that can cause severe life-threatening complications and the patient having to undergo surgery again to have the instrument removed. The job of the circulating nurse is to be aware of the needs of the surgical team and ensuring all supplies are readily available in the operating room. This includes checking all machines in the room are working, such as the suction machine. They are also responsible for the documentation of all instruments used in the surgical area, as the instrument nurse counts them out loud. Once this is completed, the circulating nurse remains in the operating room to assist with patient preparation, connecting machines, and observes for breaks in aseptic techniques. The job of the instrument nurse is to ensure the equipment in the operating room is sterile and ready for use. They count each instrument during the surgical count and place them in the correct spot needed for use so they remain sterile and quickly available. Stated by Lucy Mitchell and Flynn Rona in the Journal of Advanced Nursing, instrument nurses remain observant towards the surgical procedure to predict what instruments are needed and pass them to the surgeon or assistant. They also ensure a patient's condition is stable and respond appropriately if the patient's condition changes. At the end of each procedure, the instrument nurse and the circulating nurse finish the final count together and clear away the instrument and the equipment.